Be out in the heat today. You do need to be aware of some of the symptoms of not just heat stroke, but heat exhaustion, which is usually what prefaces heat stroke. Once you get to heat stroke, that's a life-threatening situation. Your body gets dangerously hot. You often have an altered mental state or behavior. You go from sweating and having clammy skin, usually to just not sweating at all, getting very flushed skin, a very rapid or sometimes a weak pulse as well. If you see somebody exhibiting those signs, you need to get them medical help immediately. Again, it could be a life or death situation. But on to happier, brighter things. Talking about the summer, looking a lot brighter than pandemic years past as the school year is done. We are talking about summer camps. Parents starting to line them up. We want to make sure you do it with health and safety being top of mind. And joining me now to talk more about that, I'm happy to have the medical director of Hartford Healthcare, Go Health Urgent Care, Dr. Eric Walsh. You said you've been doing these on Zooms, but we finally get to see you in person.
Yes, sir.
A pleasure, doctor. Thank you so much. I am one of the parents who probably needs this. So if I was sending my kid off to summer camp, I'd just be so happy to say, okay, get out, have fun. I would forget a lot of the steps you need to take over the course of it. First things first, what do you need to know with regards to COVID precautions?
I think you should make sure that the camp is testing everyone before they get there, understand what vaccination requirements they have, and make sure you meet those requirements. And this summer, if they're outside in the sun and moving around, they're probably not going to be wearing masks.
Yeah.
But if you're more comfortable with your child wearing a mask, if they're going to go to a movie theater or something like that, where they're going to be indoors and in close quarters, you can instruct your child in that way. I think this summer the most important thing is everyone should get to camp with a negative test, and everyone should be vaccinated.
Okay, what about medications?
Medications really should be kind of sent on ahead. It should be discussed with the camp. So if you're going to a boarding camp where they're going to be gone for weeks, there's usually going to be a nurse on site.
Okay.
Have a conversation with the nursing staff about the medications, how often they're given, and making sure that they have enough of it to last the entire camp.
Yeah, see, these are one of the things, like when you're dealing with schools, sometimes you don't know what medications they can and can't give. That also sometimes applies with schools, and I'm curious to see with summer camps with regards to sunscreen and bug spray. What should you do with that?
So the sun is an interesting one. It's obviously very good. We don't get enough sun probably here in New England overall.
Yeah.
So it's good to get it. It's the time of day matters. Yeah. So if the kids are going to be out in the sun, especially at the high times of the sun day, sunscreen is very important. But you do want them to get sun. You want them to get that vitamin D. There's even some really interesting studies on, even in the shade, the benefits of sunlight and producing melatonin in the brain. It's one of the most potent antioxidants. And that's some new lifestyle medicine stuff that's been coming out. So you want them to get the sun, but they got to be safe. So they need to get some breaks. To your point about heat exhaustion, heat stroke, they can't overheat. Kids, especially with a smaller frame, will overheat faster.
Yes.
So getting them out of, giving them breaks, hydrating them is actually really important.
Another one that I just would not have thought of, a crash course on plant safety.
That is a very good one. So if you, as a parent, it would be good to show them what some of our, kind of nefarious plants in the region look like. So this is what we call this tick and poison ivy season in the urgent care business. And so we see a ton of those things. So making sure your child understands which plants to avoid. And if you know your child has allergies to anything in particular, obviously, they should be able to identify that. But definitely poison ivy, oak, sumac, those types of things, depending on where you are in the country.
And of course, keep them hydrated. Give them that water bottle. There's no real expert idea on it. Just make sure they keep filling it up, because a lot of the times once you're thirsty, you're already a little dehydrated. Doctor, thank you so much for the time.
Thank you for having me.
And thanks for the tips, because I just have that checklist I'm going to need to go down if I'm sending the kids to summer camp. Good to see you again.